When you look at the photos in this slide, you can see no one is immune to breast cancer. It affects old, young, and every ethnicity. By the way, October is Breast Cancer Awareness Month. Here are some important facts about breast cancer. 1 in 8 women will be diagnosed with breast cancer in their lifetime, and it is the most common type of cancer in Black women. It is estimated that over 250,000 women will be diagnosed with invasive breast cancer this year, and 40,000 plus women will die from breast cancer. It is the second most common cancer death in women, next to lung cancer. The majority of them do not have a family history of breast cancer either. And keep in mind, men can have breast cancer also. Here are some common myths about breast cancer. Breast cancer is an automatic death sentence. Not true. Here are the facts. If diagnosed with stage 0 or 1, there is a 100% survival rate. Can't get any better than that. Stage 2 has a 93% survival rate. Stage 3, about 70% survival, but if it's metastatic or stage 4, only 22% survive. Breast cancer is hereditary. While this is true if there is a BRCA gene that's responsible for the breast cancer in some women, the majority of breast cancers have a negative family history. Here is a good picture of the breast anatomy. It helps you to see the breast tissue, the vasculature, and the abundance of the lymphatics. The vascular and lymphatic nature of the breast makes it easy for metastatic disease to occur. Breast cancers can affect the ducts, the lobules, and the breast tissue itself. The signs and symptoms are few unless it is in advanced disease stage. Some breast cancer is detected by self-breast exam that indicates the presence of a lump or seeing a change when looking in the mirror at the breasts. Change seen in a mirror is not a good sign because it means the cancer may be at a more advanced stage. What the patient is seeing is a puckering of the skin that is indicative of a mass beneath the skin that's pulling the exterior part inward. An MD or NP confirms the presence of an abnormality through a clinical exam. Many are detected by provider exam at the annual visit. Presence of a lump does not always mean cancer. Be sure to read the textbook about the benign conditions, fibrocystic breast changes, fibroadenomas, and other changes that occur in breast tissue. This won't be covered in the video lecture, but you do have to know the material. Signs and symptoms of breast cancer include external changes to the skin, such as dimpling or pulling of the nipple as mentioned. Other features may be a change in the size or shape of the breast. The skin may have the peau d'orange appearance, which is indicative of advanced disease. It is estimated that it takes up to 20 years for the breast cancer cells to double in size enough to be palpable at 1 to 2 centimeters size. Faster growing, more aggressive tumors may be felt in 10 years. This is why mammography is so important. We can see something long before we can feel it. If we can find a cancer when it's small, the management, treatment, and recovery is much easier than when found in an advanced state. Other symptoms include pain, especially in the presence of an inflammatory breast cancer. This can be accompanied by a rash or erythema at the site. Nipple discharge when not nursing is another sign something is wrong. Not necessarily breast cancer, but definitely needs to be evaluated. There are times a patient thinks the discharge is coming from the nipple, when in fact it is dripping from cancerous tissue that has become necrotic. Risk factors for breast cancer are listed here. The risks are modifiable and non-modifiable. We cannot do a thing to change our gender, aging, genetic makeup, family or personal health history, ethnicity, menstrual cycle, or the level of intrinsic levels of estrogen we have within our bodies. Yet all of these present as risk factors for developing a breast cancer. What we can and should modify are the risk factors associated with our behaviors, such as using birth control pills, breastfeeding, using hormone replacement therapy, that's abbreviated HRT, going through pregnancies, use of alcohol, high-fat diet, obesity, exercise, and use of tobacco. Women who do not conceive or elect not to breastfeed increase the risk of developing breast cancer. Obese women have a high incidence of breast cancer. They have irregular menses and they store a great deal of estrogen in fat tissue. Couple that with little exercise and other bad behaviors, and you can see why they have such a high risk. We screen for and diagnose breast cancer using mammography. All women have a screening exam when presenting for routine evaluation. But for women who have a complaint or something suspicious, the diagnostic mammogram is ordered. This mammogram not only looks at the whole breast, but uses magnification and sometimes an ultrasound to determine what is going on. If a cystic structure is detected, the MD will aspirate the contents. Typical cystic fluid is green and fairly clear. In this case, it's usually discarded. However, if it varies from what is expected, it is sent to pathology for evaluation. This slide provides information to you in regards to the meaning of a mammogram report. Anything beyond BI-RAD2 means follow-up is needed, usually within 3 to 6 months. As the RN, you need to keep track of these patients. Contact them in regards to follow-up. Send the requisition to the breast center and make sure the report comes to the office or clinic when it's expected. If a patient does not go, document your follow-up conversations in the medical record. If a patient doesn't respond, send a certified letter indicating the need for follow-up. The next 2 slides demonstrate how a core biopsy is performed using local anesthetic. The benefit of a core biopsy is a larger sample can be sent to pathology. Side effects of the procedure include discomfort and bruising at the site. There are various types of breast cancer, and this slide shows how common each type is in the population. And these are the 2015 statistics. This ends part 1 of breast cancer. Go on to part 2.